sleeping right now because about 3:23 a.m. Where he is right now. But he's chosen to join us live on radio in Lagos, all the way from the US. He's talking to me live right now, Dr. Amadin Osayomore. Top of the morning to you, sir.
Good morning, oh. How are we doing, my brother?
We do okay. We do okay. How US now?
The hustling continues. It is well.
Now the spirit,
not bad at all.
now the spirit with that. Thank you for joining me live on Eco FM this morning. Now, very quickly, the president of the Nigerian Cancer Society just left the studios now, and he came with an entourage, those from Borno, from Gombe, and from Lagos State. So, just talking about cancer. And one of them mentioned it like, what, cancer is something we should, prostate cancer is what we also should talk about, says especially as black men we're at risk. And I said, you know what, don't worry, hold your thoughts. I have my doctor that will be talking to me all the way from the US on the show this month. So, doctor, why is it important that we talk about prostate cancer in Nigeria today? You want to tell me?
Well, it's important. As we know, cancer is a leading cause of issues for men. Prostate cancer. I have a personal family loved one that passed from that many years ago, and our way now. Nigerian men, everybody is hustling, looking for food. We delay things too long, and by the time people find out, it has moved from prostate and gone everywhere, and caused this and advanced everywhere. And so we need to talk about it so that we can catch it early. Because if you catch it early, therapy is available. You can quickly. Much good can be done with early detection, and early detection in medicine, it saves lives and it can reduce suffering, and it can preserve the families.
Right. And now, we all talk about prostate cancer, but what exactly is this prostate? And what men take, what we collect from prostate, and why we say it's all about men? What exactly is this prostate?
Women have their own wahala.
I know, we all know that one. Don't do battle of the gender. No, we know that one. But we men, what's their own problem with prostate?
Not compound our trouble. True. I agree. Prostate is a small little thing, like a small walnut. No walnut. Not the size. If you look at your typical anatomy, it just sits under the bladder there, the bladder. And what does it really do? The job of the prostate is that it makes the fluid, provides fluids that mix with the man's sperm to create semen. So as small as it is, now small by mighty. If prostate get wahala, many things go spoil. It's a mighty organ, as small as it is there.
So wetin can they make and can they cancerous? Why, at what point does it become cancerous? What are the main risk factors? Why do we have problem with it as men?
Well, so just because you are a man, you are going to have prostate. And if you have prostate, if you're going to get the cancer, only that's where you're going to see it, because you're a man. And like I said, the other gender has their own issues.
Right, true that.
So now, why? What are the risk factors? Well, age. Once you start getting above 50, that is the time to take your prostate seriously. But if you have it in your family history is a big deal in prostate cancer. A father, a brother, an uncle, they have the history of prostate cancer, my guy. That means something is working in the family line that you need to go and take a look at yourself.
Wow.
Now, again, just being an African American, a black man, is just unfortunately it also adds to the risk factors. Then we always have lifestyle problems. Big belly, now when we get big belly, is a wahala. Poor diet, lack of exercise. All these can be contributory factors to prostate cancer.
Now, doctor, because we have a lot of things we want to talk about when it comes to prostate cancer. I have a lot of people who also, they are paying attention right now. But usually, how do I get to know? You already said that once you get to that age of 50, but how do we get to detect? How do we get to screen it? What are those things that I should look out for as a man that wants to, take care of himself?
Once you are 45 years old as a man, I know, and if you have a family history, that's the time you have to start asking yourself, dude, I suppose they go check things, especially before you start having symptoms. And what are the common symptoms you start having? Frequent urination. Now, there are many things that can cause that, but once you start having, the piece and the piece and the piece. Forgive my language, though.
No, it's okay.
English, yeah.
But doctor, now the same way they drink water now. If you drink water, you go piss now.
Trust me, it is not the same thing. It's not because you drink water. This one are senior piece. It not be the same.
Right.
Many you will even know, because you can actually, if you drink water, you expect to urinate, you can correlate.
Right.
You can tell. But you're not drinking, and all of a sudden you piss. Let's say you drink water, I piss 4 times. Now I piss 20 times. Nobody need to tell you, say, well, I don't come. Another issue is that stop and start. Some people will go bathroom. They go there, they will go slow. And then they come. Or it will come, it will stop. It will start again, we will say, what is going on? Or another easy symptom, the flow is weak. People say you can use the urine flow to write alphabet.
Back in the day, when you're still young.
It go like rocket ship. Yeah, it's not a long again. You could just piece of small, you could just knock for grants. What is going on? You don't say it don't the get issue. Quickly, blood in the urine, blood in the semen. People start getting back pains, hip pain, or they start getting erectile dysfunction. But all these things now, symptoms when it don't come, while I don't come. We really will say, before you have having all these things, when you go for your normal annual physical checkup, which we are supposed to do, but another will not they do. You're supposed to do that. Your doctor can ask questions. They can do exams, and they can really pick it up really quickly. That's the beauty about it. Right. It can be picked up quickly. Yeah.
Now, I mean, a lot of people now, they found themselves in this reality. It might sound sad or unfortunate, but now they want to know: are there treatment options available at different stages? Some people are just hearing this for the first time. They're correlating these things you're saying now to their own reality, and they say, I think this is this symptom that doctor just talked about, I'm experiencing it. Some people have dealt with it for a while, and they're realizing this is the problem right now, so they're at a different stage. Now, for each of those people listening right now, what are the treatment options available for them for each of these stages?
That's a good question. But before we run to treatment options, this is a thing that we can actually detect pretty early. So I want to re-emphasize early detection, which is built on early detection by your doctor. Which means that once you are 45 and above, he's doing things for you, doing a digital rectal exam, he's doing blood work. After when they found it, depending on the stage, all right? Then you're not talking about we're talking about surgery, we're talking about radiation. We're talking about therapy. Now, sometimes, if it's a small cancer, it is slow growing.
Right.
Your doctor can have a conversation with you about active surveillance, frequent checks, or they just do surgery right away and take out the entire prostate, or they do what they call radiation and hormonal therapy. All the choices for treatment depend on when they find it and your overall health and well-being.
Right.
That's why I don't tell you something. Are you there, brother? I cannot tell you lie. We prefer early detection for all these things. The treatment options is big, it converses very. There are different specialists that will have different conversations with you. But most of my listeners today, I will say, pursue early detection.
Wow.
Yeah, but of course, when you are inside it now, then all these things we talked about will now come in.
I mean, awesome. Thank you, Dr. Amadi, for sharing the light and bringing it down to the lowest level. Because usually when you're having conversations on prostate cancer, sometimes it sounds too grandiose for people to understand. But from the reactions I'm seeing, from messages I'm getting now, a lot of people are understanding it differently. But there are some men that their families, they are struggling with it, and they don't really have the support needed. How can you encourage them? How can families, how can friends, be of support to those who are going through these things? And what should they change about their lifestyle? Because men, we like to do different things. Yeah, Stan. So what can they change about their lifestyle, and how can you encourage them and those around them to support them differently?
This one a physician heat herself, and I be this one so. Because what I want to tell you now, if you see my belly now, I feel like I did drink 4 cattle of beer. I know they drink beer, na food. Also, I will do the first thing for you, because I'm talking to you, I'm talking to myself. We need to start working on losing the weight. Weight loss is a big deal, because first of all, early family history, you go for early checkup. Then things like weight loss. So as a man, try to find a way to begin to lose weight. Not that you need to park your car far away from door for office, maybe you waka small. You go and you try to waka. Try to find your way to find 5,000, 10,000 steps a day. Very important. If you did smoke before, smoking is an issue. You need to find out you want to find grace to stop smoking. There are different therapeutic options. We don't want to go into that one here, but smoking cessation is a big deal. You have to eat food rich in vegetables and avoid anything that can make you to become obese. Processed foods is a problem. I don't want to just. They will tell you that the distance between the food from the farm, whether or not you pluck them from ground or you kill the animal, the distance between that to your pot, it determines whether the food is processed or not.
Right.
So if it comes straight from the farm to your pot, you are good. If it comes from the farm to one factory, before you call your pot, don't they? So the closer the food is on the farm to your pot, the better the food is.
Awesome.
That's what I'll just tell you.
Awesome. That's just on point. We need to wrap it up soon. But doctor, some people have presented worries. But first of all, sir, tell us, how does your clinic, we're talking about Washington Prime Medicals now, how do they fit into the picture when it comes to helping men, with all of these, both the psychological support and of course the treatment options? Because some people tell you, they've gone to some hospitals, they've talked to some people, and they tell them they may not really be able to, get adequate intimacy or enjoy intimacy after the treatment and all of those things. You want to speak to that very quickly, doctor?
Well, I'm not gonna lie you, that can become an issue. That's why for a man, the earlier you detect it, because the thing when it is poor, if the delay is an issue. So in our facility, we can help you with early diagnostic options.
Right.
It's kind of the overall package of the male health which we provide for you. When you come in, we can do the test. We can also do the physical exam and say, hey man, this is where you are, and it's a comfortable private setup, all set up for you, that you can feel very comfortable to express yourself and have the conversation with people that are well trained and know what they're doing. We can do the test for you. We can do the exams for you. So that's something we can offer. And also, of course, the other side of it now. We're experts in helping you to get quality function. Even after the procedure, we can help. So yes, I think for us, it's almost like a one-stop shop. We can help you with early detection. We can recommend you to resources and specialists that can help you with treatment, depending on your level. And even after treatment, we can help you with therapy that can help you to gain back some function, at least most of the function, the sexual function, and confidence after the therapy. Yes, we can help a lot with that.
Now, for those who want to get in touch with Washington Prime Medicals, doctor, you want to put them through on how they can do that, where to go, or what websites to go to, very quickly.
I will give you the phone number. That's the easiest way to get in touch with us.
All right.
It is 091-639-55392. That's no number one. I will repeat them again slowly. 091-639-55392. Second phone number 081-205-75581. Yeah, it's right there on Isheri Road in Okwebi. It's very easy to find. We are everywhere.
Fantastic. Yes, Washington Prime Medical. You can find them right there on Ogunnusi Road, Isheri Road, right there, Ogudu-Isheri. Very conspicuous, very easy to find, as the doctor said. And yes, you can also be with them on wprimemedical.com for those who just want to, read more about them. About Dr. Amadin Osayomore, thank you very much. But before we let you go, final words generally for men and for those who are also around men that who are going through all of these things we've talked about. Final words of encouragement for them and their families.
I will tell you this: it is not over until it is over. It is not a death sentence, no, at all. If you catch it early, you live your life long and well. There's no shame in going to look for help. Your wife needs you to be well. Your children need you to be well. Your brothers and family. And if you have sexual dysfunction coming from it, treatment is available. Hope and healing is available. Don't let shame or fear trap you down. Get up, come, go and take care of yourself. We are willing to help as much as we can. There's always hope when a man is alive. That's all.
Fantastic. Very strong words of encouragement right there from Dr. Amadin. Thank you very much for being part of the show this morning. Joins us live from the US. And yes, it sounds very active for somebody that is talking in the middle of the night. Doctor, thank you very much for being here with us this morning.
A part of the hustling, we not the sleep, coffee the work.
I better go something on the coffee. All right, very, very good spot, Dr. Amadi right there. Yes, you've heard the doctor. Always